Hello everybody. So my name is Hetvi Patel and these are my partners here, Heta Patel and Zahan Shah. We are going to present on topic gene silencing therapies, how we manage type 1 diabetes. So this is a basic overview where we are going to explain type 1 diabetes pathophysiology, current challenges, then conventional treatment limitations, gene silencing mechanisms and techniques, therapeutic targets and clinical evidence, comparative analysis, conventional versus gene silencing, and future perspectives and conclusions. So this is basic type 1 DM overview. As we all know the pathophysiology, autoimmune destruction of pancreatic beta cells. Here the antigens are GAD65, zinc transporter 8, against which the antibodies attack on these antigens. T cell mediated inflammatory response is seen, which results in progressive loss of insulin production. Then oxidative stress and cytokine damage further induce inflammation. Genetic susceptibility and environmental triggers can induce this pathophysiology. So this is the traditional treatment, conventional treatment which we all currently use for type 1 DM, that is insulin therapy. The standard of care, multiple daily injections are generally used to treat the type 1 diabetes patients. For which we require continuous glucose monitoring, so to prevent the hypoglycemia like cases. Insulin pumps are also required. Immunomodulators are also used. FDA approved one is teplizumab, which is used to delay the onset of type 1 diabetes, as it is an anti-CD3 agent. Adjunct therapies are supportive care, plemlintide, which is an amylin analog, SGLT2 inhibitors, and lifestyle modifications. This is the limitations of conventional therapy, lifelong dependency, which shows continuous insulin requirement with no cure. As we do not directly cure the disease, it is just a symptomatic treatment. Temporary effects, immunomodulators provide only transient protection. Side effects, immunosuppression increases infection risk. Hypoglycemia risk also increases due to daily insulin injections. Further will be explained by Zahan. Thank you.
So as we all seen the conventional therapy and why we need a gene silencing therapy in the diabetes type 1. As we can see here, we have taken the example of sickle cell anemia in the picture. As we can see, when the BCL11A gene is activated, it can result into higher number of sickle cells in the body. But during the gene silencing treatment, we deactivate the BCL11 gene, which will increase the normal hemoglobin production and decrease the sickle cell production. The same we can do with the diabetes type 1, because conventional therapy only gives us a symptomatic relief, not affects the root causes. Here we are using precise targeting disease causing genes, silencing the pathways that drives the autoimmunity, and also we prevent the beta cell destruction. We target the root cause in the gene silencing treatment, not the symptoms. Here are some basic examples that have been done in the preclinical ones on the mouses, node mouses. The Cas9 CRISPR system, this is the basic and the most efficient one that we have seen right now. Then siRNA and then shRNA. Here we can see that the Cas9 gives a permanent gene editing, has a high precision rate, and is done by DNA cleavage mechanism. siRNA is more like we are degenerating the mRNA that causes defective protein production, and that will leads to the autoimmunity, autoimmune deficiency, and it only gives transient effect. But the modified version of that is shRNA, in which use viral delivery that has a long-term exposure and has a more controlled expression. And here we can see there are different studies, and efficacy. Like metal-3 gene study has shown the most efficiency than the nanoinsulin and the ones we discussed earlier. What are we have talked about gene silencing treatments, but what are the main targeting sites of the genes where we can look to shut them down and increase the patient care? So these are the basic. We have RNS, which gives the oxidative stress, increase inflammation, but in the therapeutic effect, we have enhanced beta cell survival. Then we have TLR4, which which gives innate immunity function. Thus, we reduce them and reduce the inflammation. Metal 3 that does M6 RNA methylation, in which we shut them down and do preserve beta cell function. And the following gene therapies are given, which will work on that, like CRISPR is targeting on RNLs to protect beta cells in mouse models, siRNA TLR against TLR reduce inflammation, metal 3 produce gene. These are the recent breakthroughs that have been shown in the current years, and further comparisons and will be taken by Heto Patel.
So, recent studies, these are the insulin therapy, which is a traditional therapy, immunomodulators also a traditional therapy, and we are now comparing the gene silencing therapies with the traditional therapy. So, the mechanism also, we know that insulin therapy is the hormone replacement therapy, and immunomodulators are the T cell modulation, while gene silencing is we target the gene, we modify it, and we cure it from the root cause. And the duration of insulin therapy is lifelong. The patient has to take insulin lifelong, daily. Immunomodulators, it is a limited, it is bound to some time duration, and gene silencing, it is potentially permanent, one time use. Okay. So the advantages of gene silencing therapy, it is precision targeting, means it acts on the root cause, selective gene modification without any systemic effects, without any off-target effects, customizable for individual genetic profiles. Disease prevention, it prevents the autoimmune beta cell destruction, it also preserves the pancreatic function, and potentially it completely prevents the disease from in high-risk individuals. Sustained effects, long-lasting effects, and reduced treatment burden, also potential for one-time interventions. Now, personalized medicines, it is a biomarker guided therapy and optimized for patient specific pathways. The limitations of gene silencing therapies are delivery challenges, that is tissue specific challenges. It is very hard to cross the biological barriers, so is the gene silencing therapy. Also, off-target effects, unintended gene modifications, and long-term safety effects. Also, genomic screening is comprehensive. Immune response.
So, have you done something on this topic? This is just what you are showing is a review.
Yes. No, only review.
Okay, go on.
So now we come upon the conclusions, that is gene silencing therapies change how we treat type 1 diabetes by focusing on stopping the disease and not by just managing the symptoms. Therapies have demonstrated safety with no significant side effects, and it establishes strong basis on ongoing future trials. Also, people at high risk, gene silencing offers up hope for the preventing the disease, and while conventional therapies only remains essential, and gene silencing is a promising new approach. Thank you.
So, do you know any other diseases in which gene silencing therapy is right now we are practicing in clinical practice, other than sickle cell that you mentioned? Because in type 1 diabetes, it is still in very early stage, so we don't have. So, are there any other diseases where the gene silencing, especially the CRISPR-based methods, are used clinically?
No, we as such has not. I have not gone through other diseases. Yes.
Even Clostridium difficile diarrhea is there. So now these techniques are being used and drugs are being given based on CRISPR-based gene silencing therapies. So Clostridium difficile associated diarrhea is one of the example where we are using it.
Okay.
For presentation, you had not introduced what that I
Yeah. Yes. Yeah, basically PharmD students. PharmD students.
just few questions because see,
Yeah.
paper presentation, that means you would have done something from here on. It cannot be a review.
Okay.
Not be a review. So basically it will not stand here. But just as a customary, I'll ask you a few questions. So what about teplizumab? How this work? What's the data?
We are not included in this PPT.
Yeah, I think it's not just you present the reviews, but you have to present something which you have done also when you're doing a paper presentation. And before you're presenting, you must have some idea about everything what you have presented. Like Dr. Mayur has asked you about the teplizumab. You should be able to tell something about that. And you were not able to, tell any other diseases where this gene silencing therapy is being applied. And with respect to type 1 diabetes, I think it is still very, very preliminary. There's a lot of work to be done in that. I think you can, explore a little bit, make your presentation much better, and if you work in that, it would be very nice to hear what you have done and something new you have to present instead of just showing the review.
Do you know anything about translational medicine?
Sir, actually, teplizumab is a anti-CD3 therapy where it works on T cells where the CD3 antigen is presented. So it blocks that, so prevents the inflammatory responses.
What is translational medicine? Is gene silencing is related with the translational medicine?
I don't know that. We'll work upon that.
Go and explore, because these we are in the era of precision medicine, gene silencing. So you must know something about the translational medicine. We are right now living that era. Okay, thank you.